Dental implants are an artificial root system.
Typically a screw that's made of titanium that's used to replace a missing tooth root.
After the implant has appropriately healed and integrated into the bone, the crown or cap can be placed on the top of the implant.
This can be done to replace single teeth or multiple missing teeth to help to restore your dentition to its normal occlusion and bite.
A candidate for dental implants is someone who's losing function with a single or multiple teeth and desires to have a fixed restoration.
Very infrequently is it noted that a patient is not a candidate unless sometimes heavy smokers or other medically compromised patients,
such as unusual bone diseases, uncontrolled diabetes,
or patients on chronic steroid usage, sometimes may not be a candidate, but this is to be discussed between you and your surgeon.
The biggest benefit of an implant is that it replaces your missing dentition in the closest way to your natural teeth.
When a tooth is missing, your dentist and surgeon will determine whether a bridge or an implant is indicated.
A fixed dental bridge requires the preparation or the grinding down of the adjacent teeth to place a bridge.
This is not recommended when the adjacent teeth are healthy because you're removing a lot of healthy tooth structure.
The long-term stability of that restoration will depend upon the stability of those teeth.
With a single tooth back in place, you can floss and clean your teeth as you would traditionally.
The average lifespan of a bridge is approximately 12 to 15 years.
The alternative to replacing a single tooth is placing a dental implant.
A dental implant is the closest thing to a natural tooth. You can eat anything you want, and it can be cleaned and brushed just like a real tooth.
The long-term success of implants is approximately 98%.
The dental implant will be the standalone solution with the greatest predictability and with the greatest ability to not involve more comprehensive care.
The actual surgical process for dental implants is very, very simple.
It is very conservative and comfortable for our patients.
we would place a structure into your jawbone where a brand new crown can be attached.
We'll typically do a small gum adjustment.
Sequential osteotomies or holes in the bone are completed and the titanium screw is placed.
Once the implant's placed, bone will grow around the external flutes of the screw.
It takes about 3 months for the implant to heal in the bone.
Of all the surgical procedures we do, this one is the least painful.
Typically involves about a 30-minute procedure with local anesthetic.
This involves getting numbed up, having the procedure done, and taking a post-operative x-ray. The recovery time following dental implant placement is rather quick.
Patients often return to work the following day. Generally, patients take only over-the-counter pain medication 1 or 2 times following the procedure.
Usually by the end of the first week, the patient is completely comfortable, having experienced minimal post-operative discomfort.
And then your care is usually finished with your oral surgeon in about 3 months.